Hi, it's Anthony Mosura, registered nurse, ACE health coach, and Youngevity Distributor, and it is my honor and privilege to be here with Dr. Joel Wallach. Now, if you're watching this, really this is a special treat I have for you. In previous videos, I've presented information about Dr. Wallach, as well as how to access a life-changing documentary about this man's powerful story. So with that being said, I want to introduce you to Dr. Joel Wallach. Now, Dr. Wallach, for me personally, I've been working in the conventional medical system now.
We appreciate you for that, Nurse Anthony.
Thank you, thank you. For over 11 years in a variety of roles, I've observed a lot of human suffering. I know from the data, as well as my own experience, that a lot of this suffering is preventable. It's unnecessary. And thankfully, a number of years ago, I heard about you. I was introduced to you, and my mind has been opened. My eyes have been opened. And it has been a true pleasure, as I've become a student of yours over the last few years, to not only see my health enhanced, but to be able to help others do the same with these various strategies. So, with that being said, I look forward to the good times ahead. And so, thank you for taking a few minutes of this time to go on this interview journey with me here.
Okay,
So,
well, thank you for the opportunity, Anthony, and I really want to praise you. You're in the medical field, you're a nurse, and of course you have credibility that the average person will pay attention to, as opposed to an herbalist or something like that. And so I'm really appreciative, because you bring credibility to the message, and so we appreciate it, and the fact that you're a nice young man, and it'll be great because you'll have lots of years to pass on the message.
thank you very much. So, Dr. Wallach, I in particular wanted to ask you about the fact that I work with some really wonderful people, fellow nurses. I also have some friends who are medical doctors and other people that work. And your message is just so powerful. It's changed my life. It's impacted my life for the good. And I'll never be the same because of it. What information would you like to share for my colleagues, especially for nurses out there, regarding the opportunities that exist with holistic health?
Okay. Well, nurses hold a special place. They interface for medical doctors with the patients. They interface from the information world to the patients. They also carry information from the patients to doctors and pharmacists and family and so forth. And so nurses hold a very special place, and people appreciate the credibility that nurses bring with the message and care that they provide. And so your colleagues who are nurses and doctors, I invite them to spend a little time listening to our CDs, watching the DVDs, maybe even reading parts of the books that are of interest to them. And this will add another perspective. And so you bring credibility with this information. And of course, as nurses, you see things. And you can see things that the average person doesn't see. You can see people in need, you can see people improving, and when you say something, people listen to you because of your credibility. And so from things like high blood pressure, dialysis, diabetes, obesity, heart disease of all kinds, dementias, thyroid problems, arthritis, back problems, liver problems, and so on, kidney failure. So there's all these things you can bring information, and the nutrition will bring another piece to solving the problem. The humans have been given a wonderful body. We have the capacity to heal, but we require raw materials to do this. It's very naive to expect all this raw material to be in our food, because plants only need 3 elements from the soil to make good seeds for the next generation. We need 60. And so if you're eating very well, you can be 57 short. And so as a result, a carrot grown in Hawaii, in Florida, in Texas, in Washington State, in Indiana, in New York, and New Jersey, are all going to have different nutrients in them, because the soil is different every place. And so, well, you eat something. I eat carrots and it cured my night blindness. Well, that's fine. You maybe got some beta carotene out of the carrots, and you had enough minerals to convert to vitamin A, and so you don't have night blindness anymore. But then somebody else in another state eats carrots and they're night blind, and he didn't get any effect because he didn't have those minerals to convert the beta carotene into vitamin A. And so if you provide all 90 essential nutrients, 60 minerals, 16 vitamins, 12 amino acids, 3 fatty acids, you will find that you're going to get a more consistent result in prevention, maintenance, and also in improvement when you have a health challenge. There's over 900 diseases that are preventable and reversible with nutrition. If you need for down deep in your soul to take a doctor's prescription, throw the nutrition in with it, and you'll actually get a better result from just the prescription alone.
That's a very powerful message, and you know, one of the many things I love about Dr. Wallach is you have worked so hard over the years to put this information into a variety of life-changing tools. He has many resources available for people, and he's so intelligently written these pieces of literature in a way for the everyday person to understand, as well as for those who are in nursing or at a variety of education levels. And my life has changed. I tell people I've learned more in a short period of time learning from Dr. Wallach's many books, videos, etc., than I ever did in the 5 years or so of nursing school and the prereqs associated as far as staying healthy. And like I said, you're not alone. There are a ton of resources available. In fact, I would encourage you, don't hesitate to reach out if you have questions, concerns for other resources, or even to figure out how to get in touch with Dr. Wallach or others. I can help you along with that. I can help you go down that journey together. So with that being said, Dr. Wallach, do you have any last messages for those nurses or those other healthcare professionals out there?
Well, one of the main bits of information I want your associates, nursing associates, to get is that I don't have to convince them to put 6 quarts of oil in their car or 4 quarts of oil in their car, depending on the engine, before the engine burns up. Only an insane person would put dirt from Texas or Oklahoma in their car because there's bound to be some oil in that dirt because it's from Texas and Oklahoma. Nobody in their right mind, even an insane person, wouldn't do that. When a doctor says, oh, just eat well, you get everything you need, everybody says, well, my doctor said I didn't need to take supplements. Okay, this is very, very wrong. Very, very wrong, because the nutritional minerals in the soil do not occur in a uniform blanket around the crust of the earth. They occur in veins like chocolate and chocolate-level ice cream. The only way you're going to guarantee you're going to get them all is to supplement, just like you put the 6 quarts of oil in your car. If you do that, you'll prevent so many diseases. The goal here is to have a very, very, very boring health history. I'm 80 years old. I've never been sick. You know, one of my associates here, Shar, she hasn't been to a doctor in 30 years because she's been doing this. As she's 76 years old, she looks like she's 40. Okay, and she can, you know, she can outwork a 30-year-old at her age of 76. It's one of those things where take care of yourself before you get sick. And if you've never heard the message and you have diabetes, you have high blood pressure, you're on dialysis, you have congestive heart failure, you have liver cirrhosis, you have low thyroid, you have dementia, you contact Nurse Anthony here, and let's get together and help our friends, our family, and our patients, and our colleagues. And if we save each other, we'll save America. Thank you very much.
You heard the man. Thank you, Dr. Wallach.
Thank you, Anthony.
And God bless you.
God bless you, sir.